Thank you for attending the webinar this morning on patient pay online. A little background before we start. Everybody's been muted to keep the barking dogs and the dish clatter from disturbing everybody. So if you have questions, you can submit those on the chat option, which is on your GoToMeeting screen on the right. And at the end of the session, we will answer the questions and maybe even open it up for conversation if we have a lot of detailed questions. We'll get done by 9:30, so we'll push this thing through very quickly so everybody can get back to work. Next slide, please. The presenters today, besides myself, will be Mark Snow, who's the VP for Channel Management at InstaMed, and Lori Gibson, who's a Level 2 support person at STI. What I intend to do first is go through a few things about trends in healthcare before we get into the discussion on patient pay online. So I shouldn't be yapping more than 5 minutes. Next slide, please. If you haven't noticed, everything has changed in healthcare. And the reason for that is the cloud. There's a book out by Tom Friedman about 10 years ago stating that everything in the world was going to change due to the personal computer and the internet. And healthcare is a little behind on that particular trend. But I think the coronavirus issue really pushed that concept forward. So what's happening now is data is available to everyone. And that's a good thing and a bad thing, as you've probably noticed because of the recent Russian attack on the pipeline in the southeast. So data can be shared, but it must be kept secure. But more importantly, what this allows everybody to do is work from anywhere and also to access data via smartphone as well as computer, which means nowadays, as we know, people can dictate into their computer during the day, and during the night while they're sleeping, someone in another country is transcribing that data and getting it back to you. We also know that x-rays are being read in Eastern Bloc countries like Poland, Czechoslovakia, Israel as well. So everything has changed, and STI has changed with that as well. Next slide, please. What we now have is a web-based version of our ChartMaker product called ChartMaker Go, which includes billing, scheduling, and the EMR all in one product and in the cloud. There's also a product called Revenue Cycle Optimization, which talks about how to maximize your billing as we know right now, small practices are really being hurt with cutbacks, and they do need help on optimizing their billing. There's a webinar going to be held by STI, if you have an interest, on May 19th at 12:30 to discuss that concept. We also now have a smartphone application that allows docs to see their notes from their chart on their phone, as well as their appointments, and even capture charges while they're out of the office on their phone, and those charges will flow automatically back into the ChartMaker Go billing software. So if you got a hospital-based practice like infectious disease or surgery, it's a great product. Also, if you're visiting patients in nursing homes, that allows you to capture charges from there as well. Most folks know we have managed services, which helps with security and ransomware, which becomes a bigger issue now, as well as the MIPS assistance program, which has been working through STI for over probably 5 years. New products that have come out recently: telemedicine software, electronic faxing, patient reminders and recalls through text messaging, as well as the use of voice over IP, so you can share your cloud with your phone information as well as your data. Upcoming webinars are going to include information on e-prescribing, e-faxing, And today's session is on patient pay online, which is what we're going to present next. So this is going to provide us with the ability to allow you to do your patient payments. So I'm going to turn the webinar over to the next guest speaker on patient pay, and they will bring you through the whole process. So here's Mark Snow from InstaMed. Thank you.
Thank you, Joe, and good morning, everyone. Thanks for giving us part of your day today. We're really excited to be here with our partner, STI. We became partners to deliver a better payment experience for you as providers and for your patients, and to help you engage more deeply with the financial experience with patients today. And so we've entered into a strategic relationship with STI and are able to bring you some new tools to help you collect more and lower your cost to collect. So we're going to first talk about what's happening in healthcare. And InstaMed has been around since 2004. We are a wholly owned subsidiary of JP Morgan Chase Bank. And for the 11th consecutive year, we very recently published our 11th annual Trends in Healthcare Payments report. And InstaMed, as a cloud-based financial technology software company, we have what we call a network. And it's a network of consumers, providers, and payers, all focused on delivering and processing and paying more payments electronically. And so as we do this survey every year, we commission third parties, independent third parties, to produce and analyze data. But we also survey consumers, providers, and payers that are on the InstaMed network. And right now, InstaMed actually provides electronic payments to over half of the United States healthcare provider market. And so that funnels a lot of data into our cloud-based platform to produce this report, in addition to leveraging data from third-party sources. And this report is available on our website through a direct download, so feel free to go to instamed.com and you'll be able to get to our 11th annual trends report. So what does the data show? To reference part of what Joe said, there was a huge digital surge in 2020, clearly because telemedicine all of a sudden became the clinical care methodology of engaging patients rather than in-person encounters. And so three key data points here, and you can see at the bottom of the slide the sources of this data. But with COVID-19 over the last year and a half, the internet became extremely important, said 87% of Americans, and 53% actually said it was essential. And also, payments all of a sudden really dramatically increased and moved online. Data shows that over $211 billion was spent on e-commerce just in the second quarter of 2020, which was up almost 32% over the previous quarter. And then digital payments, 7 out of 10 consumers said there'll be a major shift in payments from a digital standpoint, and that it would be permanent. And so digital payments, that's payments online, that's contactless payments, it's using mobile devices and so forth to pay bills, whether it's your water, gas, utility, or other retail bills. It's also healthcare bills. Consumers can afford less. The amount consumers say they can pay in full is shrinking. And so our data shows that 1 in 4 consumers say they cannot pay a $400 plus medical bill in full, and that half of those consumers would likely need a payment plan for larger balances today. And then about 50% of Americans cannot pay an emergency bill of over $400. And this is from our consumer survey and also the Board of Governors of the Federal Reserve report on the economic well-being of U.S. households. So the digital surge really drives innovation in healthcare. 78% of consumers want contactless options to remain in place in the future, and they want to make their healthcare payments all in one place and not have to go to either multiple portals or other platforms. They want to do it all in one place because that's what's convenient. That's very similar to an Amazon-like retail experience that many of us have today. The pandemic accelerated contactless interactions. People don't want to touch an iPad in an office. They don't want to have to actually hand their credit card to the provider. And they're not even in the, for a long period of time during COVID, obviously telemedicine was the methodology for delivering care. So what happened? 54% of providers changed their contactless payment strategy. 36% adopted contactless payments for patient collections, such as online bill pay, which is one thing STI has done with InstaMed. 52% of providers continue to promote contactless options, including telehealth and online payments, after the initial encounter and after the initial impact of the pandemic. So how do you go contactless? Let's talk a little bit about that right now. Clearly, you need to create an environment that minimizes contact at every payment touch point. Safety, efficiency, and a great consumer experience are critical success factors. Obviously, from a safety standpoint, the less contact results in the less risk and transmission of germs. Digital options and automation reduce the need for physical interaction. When you drive efficiency, you get paid faster and you spend less time and effort. And most importantly, you eliminate paper costs. If you look at administrative costs in healthcare today, the highest expense related to healthcare costs in the United States is administrative costs, and much of that administrative cost is associated with paper, whether it be paper statements, paper claims, other documents. And then consumers today, just like retail experiences, they really demand a great consumer experience. So they want digital payment experiences, so let's provide that to them. Let's remove friction from the payments process and make it as easy as possible for consumers to understand their patient responsibility and also to then be able to make those payments anytime, anywhere, any way they want. We call that omni-channel payments. So we see through the lens of healthcare and through providers today, there are really 5 key best practices from a patient engagement standpoint. I'm just going to highlight them real quickly here. Engagement. Engagement is really key today. Consumers, like all of us on this call, on this meeting today, we owe the largest amount of dollars in healthcare. So we've now become that self-pay bucket in your receivables process. We're the biggest bucket now. It's not third-party payers any longer. So how do we do this? From an engagement standpoint, that revenue cycle today begins when your phone rings and that patient's calling you to make an appointment, or they're going on your website to schedule automatically, or they're through some other channel, and then you start interacting. So let's move that cycle to pre-service. Let's reduce cost confusion. Let's look at how we can provide price transparency and provide cost estimation and really accelerate that payment process up front, pre-service. Let's offer patients multiple channel communication options: text, email, phone, IVR, et cetera, and also contactless payment options, and automate those collections and allow a patient to create a digital wallet. To the right of your screen, you see the circle of all the different ways you should be able to enable patients to pay you. We call this an omni-channel payment experience. The more ways you can enable a patient to pay you for the services you render, the more likely it is they will pay you. So let's talk about all these different ways. Let's make them available. You can see on the screen all the different ways that actually InstaMed affords a patient to be able to pay their bill today. A digital wallet, just like we all do online. It's really a terrific experience today for patients to be able to go to a portal, set up an interaction online through that portal, save a card on file, leverage their digital wallet, have a virtual file cabinet for critical payment-related documents, and interact with you online and not have to tie up staff on the phone or through other processes. It also allows a patient to pay their bill 24/7 from any internet device, mobile phone, tablet, PC, etc., any device. And then with larger balances based upon some earlier data you saw where a $400 plus bill is really challenging for consumers today, well, let's automate those payment plans. I've been in healthcare 35 plus years, and it still amazes me at times when I hear about providers writing down credit card numbers in their office, creating an Excel file of payment plans, and different payment plans with different payment time frames, where they have staff calling the patient to collect that payment associated with their payment plan. Why don't we automate all of that? Let's automate that patient responsibility. Let's have the ability to securely save a card on file with a PCI level 1 certified payment processor, certifications that InstaMed invests significant dollars in every year to ensure the safety and security of processing payments. So let's automate those payment plans with that card on file, which guarantees you're getting paid. And then add more efficiency by integrating into your core practice management system, which is what STI has done with InstaMed to automate payments that you process through Practice Manager or that are processed online. Let's enable the automation of posting those payments back into Practice Manager to, again, add more efficiency to your operation. So how does that work? Well, I'm going to turn it over to my colleague, Lori Gibson from STI, who's going to walk you through what it looks like inside of Practice Manager.
Hello, everyone. As you know, I'm Lori from STI, and now that we've partnered with InstaMed, I know some of you have probably spoken to me about your patient statements, and I've been asked over the years, can our patients pay online? And the answer was always no, but now it is yes. So once you were to enroll with InstaMed, you're given a URL for your patients to be able to pay their bill online. We now have a place for you to put in that URL, and that would go here in your practice setup for your electronic statements. And then that would print on the top portion of your statement. Do you want to go to the next slide, please? And here is how it would look on the top portion of your statement. It would print out and say, please pay, and then it would have your URL that would be specific to your office, print there, and the patient can, copy that link, paste it into their browser, and then go online and pay their bill very easily. Next slide, please. Then within Practice Manager, we put a spot where when you go to post your payments, you can set a default payment type for any InstaMed payments that would come through, so you could easily track them through the reporting, and you would put that here under your preferences. Next slide. Here is what the pending payment tab would look like. Once either your office swipes the patient's card in the office, because that's now an option with InstaMed, the patient can come into the office, want to pay with their credit card, they would swipe or insert the card to read the smart chip, and those payments, once that card is swiped, would come into here into the pending payments tab. Payments could also come into this tab if the patient were to go to that URL, and that URL is on the statement. You could put it on your website, you could put a link to it on the patient portal, and anytime a patient were to go to that link, put in their information and put a payment in, that too would show up here. Go ahead, next slide, please. If a patient were to put in their name and say, they put in Joe Smith, but in your system it's Joseph Smith, they would come up as unmatched. So you would easily able to say like, hey, practice manager says you have a Joseph Smith, not a Joe Smith. This is the same patient. You would select them, create the payment, and then you would be able to post that payment. So it handles any kind of thing that would not exactly match in your system as well. Next slide, please. If there happens to be an overpayment, the patient only owes, $20, but they pay $25, you would be able to create a $5 credit from that overpayment should there be one. Next slide, please. In the review payments and inquire screen, we would now indicate whether that payment was made via the pending payment tab by simply, if you're in that review payment or inquire tab, you can scroll over and see, was it from pending payments? Yes, it was. Then you would know that it came from there. Next slide, please. All of the pending payments are also audited in the audit trail. So you would be able to see those, that it was created from pending payments by PC admin and the date and the amount that it was created for. Next slide, please. And as said earlier, if you have any questions, please put them in the chat. You can contact myself. Here's my email, or Joe here's his email. Any questions, like I said, you can put them in the chat. And Joe, I guess I will turn it back over to you.
Hey, thank you, Lori. Do we have any questions, Chris?
We do not have any questions in chat.
Okay, let's give them a second or two to think of what they want to ask us.
Open for any questions at all that you may have pertaining the pending payments there.
Well, I guess you did a great job, Lori. No questions.
There are no questions.
Oh, yes, there's a question.
I see.
We're asking about fees and cost. So you want to go over that, Lori or Mark?
Mark, I'll let you touch on the fees, and I do see that someone asked how to get the process started. To get the process started, you would fill out an enrollment form, and that can be found on the STI website. Mark, do you want to speak about fees?
Right. So all InstaMed charges is fee for whenever a payment transaction is made. We don't charge for our software. There are no PCI fees or monthly minimum fees. My advice would be to certainly complete the form on the STI website, where we could engage with you directly and learn more about your practice, understand your pain points, and then once we get more deeply into how our system works and the solutions you're interested in, then we can, with one of our sales and product experts, talk more directly about pricing and really customize that for you once you get a better feel for how we can help you collect more in the office or the back office or online as well. So we'd be happy to talk to you directly one-on-one.
I see questions about, is STI setup open to any vendor, including InstaMed? Right now, we are partnered with InstaMed. So I would say for right now, it's really just InstaMed that we're partnering with for the, integration for those pending payments to come down with into Practice Manager. Seeing another question here. We already use InstaMed Online for payments. What is needed to link the process to clinical? I'm assuming that you are meaning that you are currently doing insurance payments for InstaMed. With that assumption, that is kind of separate from the patient payments online. So you would need to fill out an enrollment form, and then the two would link, and you would be able to process both those insurance payments and patient payments. And the patient payments would come down through the pending payments tab. but the insurance payments would still kind of need to be posted manually. The insurance payments would not come down into the pending tab. Hope that answers that question. And it looks like there's another one kind of more for the InstaMed side saying that your answer about fees is vague. Is there a percentage attached to the fees?
So whenever a payment is made, there will be a transaction fee. A transaction fee is a percentage. So InstaMed is a certified payment processor, so all we charge is a percentage of the payment that's made.
I see that it says, does it automatically apply a patient payment? No, it does not automatically apply the patient payment. Once the payment comes down into pending, it sits there so it can be reviewed by the office, and then it would need to be posted. And the posting of the payment is simple. They would just, see the payment in the pending payments tab, say, okay, this is the charge I want to apply it to, hit save, and then at that point it would be posted to the patient's account. And how does the office get paid? I believe once the patient makes those payments on the InstaMed site, or the office slides the credit card through the InstaMed site, then at that point that money is deposited into the bank account that you agreed to with InstaMed.
Yeah, InstaMed will connect directly to your bank account, and once we process that payment, we will move the money all the way through the card networks, and we will deposit all the monies that were paid. We'll deposit them directly into your bank account, and you'll see that in the reporting side of InstaMed. One of the things I would recommend, folks, any of you that are interested in continuing the discussion with us, we can absolutely take you through a demonstration of how the payment flow works and show you sample reports of how those payments would appear through InstaMed and how they would reconcile with your bank account.
Yep, and it looks like they're asking what your percentage for your fees is, Mark.
It really depends on volume processed by the provider, and we individualize our pricing. It's not one size fits all. So we individualize the pricing based upon your payment card volume that you process. And there's no other fee. So think about it almost like a pay-as-you-go. So if there's a payment made and we process it, there'll be a transaction fee associated with that payment. There would not be any other fees. So we don't have a one-size-fits-all pricing model.
Yep. The next question is, can patient payments be also retrieved via InstaMed website instead of the pending payments? If the payment's made on the InstaMed site, you'll always be able to see it on the InstaMed site, but it's not going to post into Practice Manager automatically. So if you don't want to use the pending payments tab, that is an option, but you would still need to manually post those payments into Practice Manager. But with the InstaMed, you'll see them there. They'll come into the pending payments, and you could post them that way, and you can run reporting on both the InstaMed site and in Practice Manager to reconcile. Hope that answers your question there. Not really sure if I did, but any other questions? Perfect. Glad that answered your question. Any other questions?
Okay,
Again,
well, that's...
Yep.
Okay,
again, if you're interested, you can enroll on our website.
Right.
Go ahead, Joe.
Okay,
All
thanks,
yours.
Larry. Thanks, Larry. Thanks, Mark. Thank you all for attending. It's like we're 9:30. A couple upcoming webinars. If you have more interest in revenue cycle optimization, we're having that on May 19th as well as June 23rd. Also, we're having a webinar for surgical practices and surgical centers on June 9th and July 7th. In the next user group webinar is going to be on June 16th at 9. Everybody's going to get a call back from Rose, see if you have any questions that you may want to talk about privately, and we'll contact you and see if you have any questions going forward. So thank you for attending. Last chance for questions, and if not, we're going to end the meeting.